Hey, welcome back, guys. I'm back at it again. Um, Putting together a video here about the fallout from the veterans update that happened 2 days ago. It seemed to fly by with pretty much no backlash or any kickback from any kind of veterans organizations, as far as I saw. But the way it went is supposedly to go where if you're taking medications and you're going for a CMP exam, from what I gather, from what I've been listening to from this platform and another platform where lots of belly aching been going on, is if you're taking medication and you show up to a CMP exam and you're being medicated for that issue that you're being examined for, and you have nothing going on at that time, that the examiner or the rater could actually say your symptoms are taken care of or you have no issues or no problems. But as far as, does that mean that some veterans will not take their medications before going to a CMP exam to get an exam where they will possibly retain their disability compensation claim status? Or do they take the medication and the rater sees that, hey, maybe sometimes the medication doesn't work all that well? It's going to open up a lot to interpretation, and especially with the raters or the examiners not being up to speed as far as the particular cases and what they should be looking for, or what, I hate to say trigger words because it's not really triggering words, but what in the past, what we've done as far as veterans is go to the CMP exam, show up to the CMP exam. Hold on. As you probably heard, I'm close to Tampa Airport, and I'm at the Cypress Park Beach recording this in the park here. And we do have some overhead aircraft traffic from the Tampa International Airport. But getting back to what I was saying, it's going to leave up to interpretation what the rater, what they're telling these raters, what they should be looking for during these rating exams. See what they call compensation and pension exams. Compensation and pension exams, CNP exams. So will people stop showing up for the exams, or do they show up for the exams unmedicated so that they can get the best possible review of their maladies or not? Some people can't go without their medication, especially if you're talking about a person with maybe some heart issues or some stroke things going on, or issues with medications for their musculoskeletal pains and things like that. Some people can't cope without those medications every day. As far as myself, I had to myself because of my inflammation on my back and my knees, and I'm still seeking treatment, and I've been out of the service since 1993. Okay? And these things, they just don't go away, and all those, to me, of what the medications do is they're a stopgap measure. So you could take all the medication you want, but you're going to only get that amount of relief at that time that you're taking the medication. So what happens when you run out of the medication? Most of the time you have to go for something that's over the counter. And you have to find something over the counter that's going to take care of your situation better. Maybe better than what that medication that came from the VA was. Because I get all my medications from the VA. All of my physical therapy. Sometimes I get the because I was in the pain management clinic in the hospital as an inpatient. You get a certain amount of up to like 12 visits for chiropractic care, acupuncture care, and sometimes you can also get what's called Aqua therapy. The Aqua therapy has to be within the area. Luckily, here in Tampa, at the VA hospital here, there is an actual pool that they perform the the aqua therapy in. There's a wading pool, and there's a larger pool on the side where you do all your exercises, your calisthenics within the water, and they train you on what you should do as far as while you're in the water to help alleviate your pain and get you some range of motion back in your joints. But there's going to be a lot of arguments and a lot of backlash. And I hold on. I guess we'll see what happens when time will tell how this new update will affect veterans in the upcoming future, because they're pretty much trying to, from what I see and what I understand, they're trying to use an AI tool to maybe batch adjudicate claims. And what that batching does, they could possibly be looking for DBQs that are what they would say come from a DBQ mill, where people are using special, not just special words, but keywords or words that trigger a response within the system or the AI if it gets flagged by the system saying, hey, this batch here is using the same type of words, and the person whose claim this is, if they're over 100 miles away from where they live at, why is that happening? Why is this person using that service? That's a lot of that stuff is going on too. And I've actually saw the listing of VA, what they call claim sharks, or services that people have been using over the years to file their claims based on them doing particular DBQs for that particular veteran. And I, at one time, when I have done my claim, I would say maybe 15 years ago, I sought the services of one of those people or one of those agencies. At the time, 15 years ago, I wasn't aware what their game was, but after seeing what their game was and that entire list of names, I'm so glad that I didn't go further with them. I mean, they didn't get any money from me or anything. They didn't take any money up front. Because what they did was they had me send all my information. I sent my updated claim to them. They looked it over. And what I think was, because of the fact that my incidents that were going on in the service, they were so far back, they didn't want to put the legwork in to try and, I guess, put a decent claim together. So for me, that was fine. And I went on ahead and filed the claim on my own. And I did it on my own since 2014? And since 2014, I've had no problem with my claim at all as a veteran. It's just that you got people who try to cut corners and use services that really they shouldn't be using, and the VA is clamping down on these people. And I'm going to be putting a post together on some of the names that I saw. I'm not going to shout any names out, but I'm going to just say how many of them was in the list and put a post together about that. So with that being said, don't forget to like the video, subscribe to my channel, and hype this video if you have a chance. And don't forget to comment if you have a veteran in your life looking to have his claim done. So I'm going to go ahead and close this video out, and I'm going to upload it, and I'll be looking forward to you guys commenting and sharing this video and liking it so it can get a little bit more exposure in the YouTube platform. Take care and hang out for the next one.